Hi, I'm Maria and I'm going to be doing a presentation on toxoplasmosis. So a brief introduction to toxoplasmosis is that it is an infection caused by a single-celled protozoan parasite called Toxoplasma gondii. There are 15 strains in total of the Toxoplasma gondii, but there are three main strains that cause the most infections, and that would be type 1, type 2, type 3. Type 2 and 3 are the most common, type 2 being for humans and type 3 being for animals. And the image on the bottom is what Toxoplasma gondii would look from a microscope. So Toxoplasma gondii is an obligate intercellular protozoan parasite that infects most species of warm-blooded animals and has cats and livestock as its host and has mice as its intermediate host. And I also have the taxonomy for Toxoplasma gondii from the domain Eukarya to its species. And then I also have the internal instructions of Toxoplasma gondii on the image on my right. So the history of toxoplasmosis, Charles Nicole and Louis Mensal first identified it in 1908. In 1923 was the first recorded case of a baby contracting the disease from the womb. In 1960, cats were found to be the most common host for toxoplasmosis. And in 1980, toxoplasmosis was determined to be a major cause of death in immunocompromised patients. So the life cycle for Toxoplasma gondii has three life stages: sporocyte, radiocyte, and tachyocytes. So sporocytes are combined of tachyocytes and radiocytes, while tachyocytes are a form of rapidly reproducing Toxoplasma gondii, and the radiocytes are the form that slowly reproduces and is contained within a tissue cyst. So what happens is that sporocytes infect epithelial cells in the gut of cats or livestock, and then the sporocytes differentiate into tachyocytes, and then the tachyocytes infect any and every cell that it can. And then this is where the disease occurs. This is where toxoplasmosis happens during the tachyocyte stage. And then those tachyocytes are differentiated into radiocytes, and the radiocytes can attach to brain, muscle, or liver tissue, and they persist throughout the host's life. So some sources of transmission are cat or livestock feces, and this is the most common one. So what happens is that the cat secretes oocysts, and then through the oocyst, transmission occurs. And oocysts just are the result of the first life stage in the life cycle, which is sporocyte. And the transmission can happen through either cleaning out a cat's litter box, or even contamination of food, water, or utensils used in consumption. And so it's through oral transmission, which ties into our second source, which is undercooked meat. And the meat usually has tissue cysts in it, and that's what causes the transmission, the ingesting of those tissue cysts. And this mostly occurs in pork. There's also horizontal transmission, and this is through medical procedures such as organ transplants, or very rarely blood transfusions of an infected person. Vertical transmission, it occurs from mother to child, and this can result in a specific type of toxoplasmosis known as congenital toxoplasmosis, which is also why vertical transmission is sometimes referred to as congenital transmission. Congenital toxoplasmosis results of primary infection with Toxoplasma gondii during pregnancy, in which the transplacental passage opens during the tachyocytic stage and infects the fetus. So during the first trimester, transmission is relatively low, with about 20%, but increases by the end of pregnancy to around 80%. In early stages of pregnancy, it is most common to get severe infection, and this is usually during the first trimester and a week into the second trimester. And this can result in spontaneous abortion, which is miscarriage, hydrocephaly, and mental disorders. And then during the last trimester, the baby will most likely be born asymptomatic. However, it has been shown that those babies in adulthood can develop vision problems, and sometimes blindness can occur. Diagnosis is not usually used for toxoplasmosis, but it can be used on pregnant women through serologic testing to find IgM antibodies, or diagnosis can be made through biopsy stains. And the triad of symptoms are chorioretinitis, which is that first picture with the eyeball, and chorioretinitis is just inflammation of the choroid, which is the lining of retina deep in the eye. And then there's also hydrocephalus, which is the middle picture, and that's an abnormal buildup of cerebrospinal fluid in the brain. And there can also be intracranial calcification, which is that picture on my right. So the immune response to toxoplasmosis requires both innate and adaptive immune responses. The immune system uses enterocytes, monocytes, dendritic cells, macrophages, natural killer cells, and neutrophils. The monocytes play a key role in mucosal immunity. The dendritic cells are used to process for antigenic presentation, and neutrophils secrete IL-12, which can directly kill the parasite. So some symptoms of toxoplasmosis. Most healthy people infected with Toxoplasma gondii are asymptomatic, but can experience flu-like symptoms and have muscle aches and pains for up to a few weeks. However, there are some cases of healthy people getting toxoplasmosis and having symptoms such as fever, aches, fatigues, and blurred vision. Those most at risk of developing severe toxoplasmosis would be babies born to a mother who was just infected before the pregnancy or during. Before the pregnancy would be usually 1 to 2 weeks before. If it's anything before that, doctors aren't worried about the transmission. Also, individuals with immunocompromised systems, such as especially those with HIV and AIDS, and also individuals undergoing certain types of chemotherapy are at severe risk of developing severe toxoplasmosis. So prevention and treatment. Prevention is just regularly and safely cleaning out cats' litter boxes. The CDC usually tells people to wear gloves when cleaning out the cat litter boxes. Also hand washing, using safe internal cooking temperatures, or just fully cooking your meat, especially pork, and then washing all fruit and vegetables before consumption. For treatment, there's no vaccine available at the moment for toxoplasmosis, since most of the people contracting it are asymptomatic. However, for severe cases, there is antibiotics and folic acid supplements that can be prescribed to you by a physician. Okay, and then some toxoplasmosis statistics. This quote is from the CDC, that more than 40 million men, women, and children in the US carry the Toxoplasma parasite, but very few have symptoms because the immune system prevents it from causing illness. Up to 50% of the global population has been infected, 11% of the US population has been infected, and 90% are asymptomatic. The Toxoplasma gondii parasite primarily is in places with warmer climate and areas that are less developed. And toxoplasmosis is the second leading cause of foodborne illness related to death and hospitalization each year. And there have been some studies that have found schizophrenia to be related to toxoplasmosis. So toxoplasmosis could be, one of its potential causes could be schizophrenia. And that's it. Thank you.